Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
I'm Dr. Andrew Harris, Chair of the American Urological Association's Quality Improvement and Patient Safety Committee. We're kicking off a special 4-part podcast series designed to accompany the AUA's Quality Improvement Project Guide. The first episode will introduce you to the guide, walk you through how it can be used in your own QI work, and highlight some of the key methodology mentioned in the guide. I'm here today with Dr. John Lamb, a urologist at Kaiser Permanente in Southern California, and one of the authors of the QI Project Guide. Hi, Dr. Lamb. Thanks for being with us today.
Yeah, Dr. Harris, thank you for inviting me. And it's my pleasure to be able to talk about healthcare quality.
Well, we appreciate you being here. And before we jump in, can you tell me a little bit about what healthcare quality means to you?
Yeah, absolutely. So as you know, I'm with Kaiser Permanente. We're a large integrated healthcare system, but we take a lot of pride in our mission is value-based care. So healthcare quality is a lever of value provided by any healthcare resource as determined by some measurement. As with other quality in other fields, it's an assessment of whether something is good enough and whether it's suitable for its purpose. So the goal of healthcare is really to provide medical resources of high quality to all those that need them to ensure a good quality of life, uh, cure illnesses when possible, and to extend life expectancy and so on. We can also use a variety of quality measures to attempt to determine healthcare quality, such as counts of therapies reduction or lessening of diseases identified by medical diagnoses, a decrease in the number of risk factors for people that have been following preventative care, or even a survey of health indicators in the population who are assessing certain kinds of care. So quality of care plays an important role in describing the triangle of healthcare relationships between quality, cost, and access to healthcare within the community. And we can measure healthcare quality, identify problems caused by overuse, underuse, or even misuse of healthcare resources. So in 1999, the Institute of Medicine released 6 domains to measure and describe the quality of healthcare in its landmark publication, Crossing the Quality Chasm, a new health system for the 21st century. And according to this report, quality healthcare should be continually strive to be safe, timely, effective, efficient, equitable, and patient-centered. And we use this as known by this acronym STEEP, STEEP. So in the context of these widely adopted aims of healthcare quality, it's commonly accepted that quality improvement initiatives should strive to improve on one or several of these STEEP aims.
I appreciate that discussion, Dr. Lamb, and I appreciate your comment on a variety of quality measures. And I think quality is one of those things when we talk about it, most of us have a loose understanding of what quality is, but when we're asked to define it can be somewhat difficult. And I think that crossing the quality chasm gives us somewhat of a guide, but even safe healthcare can have some laterality in the definition depending on what we're trying to measure. And so I appreciate your comments. And I think as we, start talking about how we have improvement, not only is it important to understand what some of these quality measures are, but then how do we start to make them better? And so I appreciated your discussion. What I want to ask you now is, why did the AUA develop a guide to introduce how to do quality improvement projects?
Yeah. So, as we all know, like healthcare delivery systems and different payment models have been increasingly emphasizing a transition, from volume-based to value-based care. There's also been an increasing focus on quality improvement and patient safety just across the whole healthcare landscape. So while resource intensive like healthcare, health system level improvement models are often the focus of our payers and insurers and hospitals alike, there's also a role for like simple interventions carried out either at the individual level or practice level to impact healthcare quality. So this guide is really to kind of help educate those folks that are unfamiliar with doing a quality improvement project.
Yeah, I appreciate those comments. And we talk a lot about healthcare quality, but then you mentioned information about value and what is value in healthcare. And when you look at that definitions, it's outcomes and experience over cost. And so, if there's a way to use some of these tools to enhance any of those variables, then we can improve healthcare value, which sometimes can be done as these quote unquote simple interventions at the individual provider level, in a clinic or on a floor or in a specialty OR. So appreciate those comments. And expanding on that a little bit, what's the main intention of the guide that the American Urological Association has put out?
Yeah, so the purpose of this document is really to provide anyone, that's involved in urologic care delivery. So whether it be doctors, nurses, administrators, or any practice managers, really just with the introductory understanding of quality improvement and patient safety methods and principles necessary to carry out these quality process improvement interventions.
Yeah, I appreciate your comment. And how often do we see an issue in our daily practice, know that it is a problem, and we have some ideas about how to fix it, but we don't quite have a framework with which to try to improve that metric or process? We see it all the time in our day-to-day work. And I think the AUA has done some work here to try to help provide a guideline or at least some tools to say, hey, if you have some great ideas, here's some tools you could put those ideas in to help move the needle on that metric that you're seeing that clearly has some room to improve. Anybody can do it. Right? This is a guide for anybody. Anybody in the clinic, anybody on the floor, anybody in the OR, anybody at any educational level can really start to take this guide and try to make things better, which I very much appreciate. And this document chose to use the model for improvement as the guide for improving processes. And can you tell us a little bit about the model for improvement, Dr. Lamb?
Yeah, absolutely. So just to wind back a little bit. So quality improvement, it's looking to standardize processes and structures so that variations are reduced, and therefore hopefully our patient outcomes are improved. So often prior to starting a quality improvement project, you want to think about some key areas. And the Institute of Healthcare Improvement, their model for improvement is a framework that is a more formal way of developing an idea into a structured quality improvement project. This guide will kind of show you a figure of the model for improvement. This model for improvement has two parts. The first part are the fundamental questions. So there are three questions that are very helpful and need to be answered to have a successful quality improvement. So the three fundamental questions that can be addressed in any order: what do you actually want to achieve? And the second question is, how do you know that change is going to be an improvement? How are you going to measure that improvement? What are the specific aims? It needs to really be measurable and even time specific. And the third question is, what change can we make that will result in an improvement? So what measures are you going to use to determine whether the change has led to an improvement or not? So these questions can be really helpful in focusing down your ideas, because in the beginning, when you have an idea, it still needs to be focused down to some measurable improvement that you can show impact in either whether it works or it does not work. So there needs to be some measurement and data collection of that quality improvement.
Yeah, I appreciate those thoughts. Thank Dr. Lamb. I think so often, we're pretty good at knowing what we want to accomplish, right? Like decrease surgical site infection rates, improve turnover times, increase clinic throughput, increase patient satisfaction. Like we're pretty good with that part. However, knowing what change to make, or how will we know that a change is an improvement, I don't think we're quite as good there as we are as understanding what we're trying to accomplish. And I think this framework helps you kind of put some more definition around that. What metric are you trying to influence? And we'll get into process metrics and outcome metrics as this podcast series progresses to help us better figure this out. So I appreciate those comments, and I think we're already a third of the way there, most of us, about knowing what we want to try to accomplish. And I think this framework does a nice job of helping us get a little bit more definition of measurements and what changes we can make and how we know that we have an improvement. And so you said there's a second part, and I think that's the plan, do, study, act cycle. Do you mind to expand upon that a little bit?
Yeah, absolutely. So the second part, is the plan, do, study, act. So it's a simple, popular tool for quality improvement in healthcare. It's really based on a trial and learn approach. So this too is a cyclical model that's based on a continuous process improvement that includes 4 stages. And it initially focuses on testing the proposed changes at a limited scale in order to reduce risk, then learning from subsequent cycles to inform the scale up of the changes. So the plan stage, it's helpful to reflect on the current situation. So what problem or area that needs improving? What do you want to accomplish? And what changes would improve the situation and make it better? For the due stage, it's important to gain authorization and approval from the appropriate peoples, and team support is essential. So another key thing is to start small, as well as the pilot data collection tools, testing the change and monitoring the progress. And the study stage is the third stage. This is where you reflect on the tests and analyze the data. So, has the change worked as you predicted? Does it differ or align with what you predicted or what you've expected to happen? So in the last stage, which is act, what changes should be made for the next cycle? So you need to decide whether to spread, stop, or implement the change further. And are there any areas that need modifying or adapting? Are there negative effects that need removing? Implement change on a small scale until a certain improvement, and then you can widen it out. And then you just keep on repeating this until the desired change matches your aims.
Well, thank you for that description. And we'll look forward to getting deeper into those as this podcast series progresses and have some specific dedicated time to get more information on each of those phases of the model for improvement. So we're coming up on the end of our time. One last thing I wanted to ask you, Dr. Lamb, is, can you share an example where you use some of this methodology to help make things better where you are?
Yeah, absolutely. So within our organization, just to keep in mind, we care for about 5 million plus patient lives, have 16 different hospitals, over 100 urologists. So there's always some variability, with regards to care. And one of the quality improvement initiatives that we kind of looked at was something, simple. And one of the things that we looked at, we thought there was some variability with patients undergoing care for bladder cancer. For those undergoing transurethral resection of a bladder cancer that is non-muscle invasive, and whether they were receiving postoperative of chemotherapy, whether it be mitomycin or gemcitabine. So we found out there was, some variability in this. Not every single urologist was necessarily giving, postoperative chemotherapy for whatever reason. And we kind of, looked into it. And some of it may have been, education of the urologist. Maybe they didn't understand the data or the necessity to give, postoperative chemotherapy. There were other factors that led it. If you were doing maybe the case in a surgery center, they had a hard time getting the drug over, because the pharmacy didn't have access to this particular surgery center. Um, and for whatever reason, and or even other issues like if there was some concern for bladder perforations, that would, when we explored this question, there were all sorts of reasons why a patient didn't receive the postoperative chemotherapy. So what we've done is we kind of, we provided some education, made sure that, this guideline was educated amongst all urologists within the Kaiser Permanente system. Understand that postoperative gemcitabine or mitomycin would be, considered, standard of care, especially for those with non-muscle invasive bladder cancer, and preferably low grade. Um, and What we did was we also looked at trying to figure out why the drug couldn't get to certain sites, whether it be a pharmacy issues, and we had to kind of work closely with hospital and pharmacy to kind of get the drug delivered, appropriately. And just going through these quality improvement measures, we kind of increased the percentage of the patients that were able to kind of receive post-operative chemotherapy, hopefully improving patient outcomes, and is was the goal.
Right, thanks for that explanation. Really want to thank the audience for being with us today. Thank you, Dr. Lamb, for taking time out of your day to share some of your quality journey and how important it is for you and your practice with us today. That wraps up the first episode in our 4-part series on the QI Project Guide. Today, we introduced some foundational terminology and methodology used in the guide. Be sure to tune in the next 3 episodes where we'll dive deeper into the project guide. If you're interested in accessing the project guide, please visit auanet.org/quality.
This has been an AUA News Inside Track podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.